So recently, I had a young Spanish woman in my comedy class, and she thought it would be fun to open her set when she was performing by asking audiences what it is that makes them proud to be British. And she wrote some funny little jokes about what she would say if they said the Queen or fried breakfasts or Wimbledon or whatever. And then the next week, she came back to my class and she said, nobody said any of those things when I went to an open mic night. And I was like, what did they say? And she was like, the only thing anybody said was the NHS. We had lockdowns to protect the NHS. And now we've recently been told that we're not having any more lockdowns. Great. We're going to instead start living with COVID. And that means that the NHS now has to deal with a whole new type of problem coming in, with a whole new group of people coming in sick, and also with additional hygiene measures because COVID is so much more infectious than anything that we've dealt with normally, and also with ongoing staffing losses because people test themselves, and if they have COVID, the last thing they want to do is go and work in a hospital or around people who've got serious medical conditions. This week, 6 hospitals in Yorkshire have told patients not to come to accident and emergency unless their condition is life-threatening, simply because they are so overwhelmed. Waiting times in accident and emergency have been as long as 12 hours in some of these hospitals. And it's working the other way as well, because GPs are overrun and it's difficult to get appointments and it's difficult to get seen when you've got something that isn't life-threatening. A study by the International Cancer Benchmarking Partnership says that in the UK, and this is a much worse statistic than lots of other well-developed countries, now 1 in 3 cancers are diagnosed in accident and emergency. People don't get that proper assessment and that opportunity to get treatment until it is actually a real emergency, and that means that it's much, much less likely that they'll recover and much less likely that they'll get a good outcome from the situation because it's been left that late. You know, we all clapped for the NHS and we all did that kind of stuff, and the government assured us that, you know, these brave people who made it through the pandemic and sorted it all out for us would be rewarded for their efforts, but instead they were given completely trivial pay raises, and especially trivial in the context of the massive cost of living crisis, which meant that existing staffing shortages within the NHS haven't been covered at all. We haven't even gotten back up to the level of staffing that we thought we needed before the pandemic, before we were trying to live with COVID. We're not even up to that level, let alone filling those gaps and building more capacity, which we now need because we're living with COVID. And now we're also asking hospital workers to pay for their parking and all this kind of stuff. And all the sort of temporary support they were given is being ripped away. Thousands and thousands of nursing vacancies remain unfilled. And we can't really blame people for not rushing into nursing when at the same time we're seeing nurses queuing outside food banks because the pay and conditions are so poor. So the frightening thing is that it would appear that the government is basically deliberately running the NHS into the ground as a step towards privatising it. And that's really, really frightening. In the US, where there is not a national health service, 66.5% of bankruptcies are tied to medical issues. That's 500,000 families a year. So the population of the US is about 300 million. That's about 100 million families. If we assume a sort of 3-person family size, that means that over 25 years, your sort of adult life expectancy, there'd be a 25% chance that you and your family would face bankruptcy due to medical issues. And on top of that, another huge chunk of people filing for bankruptcy cite helping family and friends as one of the main driving factors behind it, which suggests, well, of course, you know, maybe you would remortgage your house if your mum was sick or your brother or sister was sick, even if they're not part of your core family. And let's be super clear, most of these people do have health insurance, but health insurance companies, they don't just give you a flat rate for here's health insurance for anything. There's certain conditions that are excluded. There's a maximum amount of money that you're allowed to claim on the health insurance. There's like a limit to this. You might be thinking, well, that's never going to come here. But the question is this: how close are you to being able to afford your own medical costs if we end up in a genuinely privatised system like they have in the US? And remember, a lot of parts of the NHS are now being bought up by American healthcare companies, which is exactly the situation that we're headed towards. Let's suppose you're a homeowner. About 40% of people get cancer in their lifetime, and the cost of cancer treatment, if you're very, very lucky, would maybe stay in the range of 50 to 100 grand. That's if you need perhaps one small surgery, some chemo, some radiotherapy, and nothing else. If one round of treatment is enough for you. A lot of people don't have that much to lose. 2,000 people a year in the UK need a bone marrow transplant, and the cost of that, I have it in dollars, but it's $600,000 to $900,000. That's your house, isn't it? For sure. Even if you've got quite an expensive house, that's you and your family with nowhere to live. The cost of being picked up by an air ambulance if you have an accident while out walking in a remote part of the country could be as high as like 150 grand. Lying there on the side of, the path up some remote, delightful Scottish island that you thought you were going to have a nice holiday in, thinking, well, that's the house, isn't it? That's the mortgage. That's everything we've got left just to get you off of that path. And even if, and then of course for a lot of people, they don't own their own home and they're not nearly that close to being able to cover these kind of costs. A friend of mine this week was in a DIY shop when a member of staff slipped over while holding a little stepladder that they were using to try and get something down for my friend, and it gave him a cut in the back of his leg. So he went into A&E. Went into A&E about 5 o'clock. About 6:30 he was given some painkillers and referred to the urgent care centre. Sat 4 hours in the urgent care centre, and I'm going to quote this right. I spent 4 hours watching overworked and under-resourced staff desperately trying to cope with a packed waiting room of agitated people, many of whom had been waiting for treatment since the morning. There was no information, there was no one on reception. The entire unit had one doctor and 2 nurses because staff were either off sick or posts were vacant. I've done this flicking it too fast. They were incredibly patient. The nurse who had initially seen me was supposed to finish at 7 but didn't get away till 9. The guards were really sympathetic. They brought people sandwiches and coffees and things, but they said exactly the same thing as all the nurses and doctors that I met, which is that the unit had recently been privatised and that it had been a chaotic mix of bad organisation and understaffing ever since, that many staff had left for the private sector or just left completely, and that all their complaints were falling on deaf ears. Eventually got some treatment, was given an x-ray, further assessments, all of this kind of thing. Had my friend not been able to access the NHS, had he been looking for that treatment privately, it would cost about 20 grand. That's 20 grand for somebody tripping over with a stepladder next to you in a store. I'll show you the photograph of his leg, but don't look away if you're squeamish. And you might be thinking, oh well, I'd get health insurance. Don't worry, I'd get health insurance. But the majority of those filing for bankruptcy in the US because of health costs are people who already have insurance. Health insurance is not the solution to that, because it inevitably means that people who are less likely to get ill get cheaper premiums, and people who already have medical conditions and are prone to medical conditions find it harder and harder and more expensive to get that insurance. And we're in the middle of a cost of living crisis where a lot of people are choosing between heating their homes and eating, and I don't really think we can turn around to those people and say just pay for, not just for health insurance, but for the top end health insurance in case you get really sick, where they will cover all the expenses and all the conditions, not just the first few, because that's not realistic and it's not going to happen. And all of this ends up costing us money, whether it's costing us money because we have to sue the local store for the accident we've had to try and get that money back. It ends up costing our time while we try and sort these things out. It costs people's homes, it costs people worrying about these things, and it costs people not being able to go to work and do all that kind of stuff because they have to instead wait around until they can find a way to pay for the treatment that they need. We have to stick up for our health service. It would appear to be the one and only thing that British people genuinely feel proud of, and that's a beautiful sentiment, and it now needs translating into nothing short of a revolution. See you next week.